Now, talking about the lymph nodes, we will just see most of the places the lymph nodes appear similar, and the differentiating features are also similar. So, differentiating between benign and malignant lymph nodes. Now, the first thing is that whenever you are looking for lymph nodes, linear probe is usually helpful, except that when you are looking for any deep lymph nodes like the retroperitoneal lymph nodes and all, usually we use the high frequency linear probe. So related to breast sonography, when we are talking, then yes, we will be using the high frequency linear probe. Now, how to differentiate? First of all, keep this in mind. Most of the times, normal lymph nodes are usually not seen. Very often, they may not be seen. But at the same time, be careful. When you are seeing them, you don't interpret them to be abnormal. I will be telling you what are the features that will indicate that this is a normal lymph node or this is an abnormal lymph node, and then the differentiating features between benign and the malignant lymph nodes. So this is first important thing, that no single criteria can strongly differentiate benign from malignant lymph nodes on ultrasound. There can be an overlap in the features, so don't rely only on one point that yes, I'm seeing this, so this is benign or this is a malignant. There can be an overlap in features, and obviously the ultimate diagnosis will come with biopsy, but still ultrasound is reasonable enough to differentiate the benign from malignant lymph nodes. Now let us first look at the structure of a normal lymph node. A normal lymph node usually will be oval in shape. It will have a central echogenic hilum. The thickness of the hilum can vary. In some patients it may be less, in some people it may be more, depending on how much is the fat content in the hilum. The echogenic appearance of the hilum is because of the fat. The cortex of the lymph node is hypoechoic and usually uniform. The size of a normal lymph node usually ranges between 5 to 8 millimeter. Sometimes it may be even less than 5 millimeter, or you can say 0.5 centimeter. And but whenever the lymph node is more than 1 centimeter in the shortest axis, more than 1 centimeter in the shortest axis, we say it is suspicious, and more than 2 centimeter in any axis is likely to be pathological. The usually oval in shape, axis ratio long is to short, more than 2. Right, so this would be the shorter axis, this would be the longer axis. Usually the longer axis will be double or more of the shorter axis. Then size we have already talked about. Then echogenic hilum and homogeneous hypoechoic texture with uniform cortical thickness. This is the cortical thickness. Measure it even in the thickest part. It should not be more than 3 millimeter. It should be less than 3 millimeter. Then comes the vascularity part. Vascularity is be from the hilum. No, hilum word itself tells you that the vessels will be coming from here. So the vascularity or the blood flow will be from the hilum towards the peripheral areas. So the peripheral areas may not show you vascularity. The central hilum area will show you vascularity, just like the kidney sinus. Then the margins of the normal lymph node are usually smooth. Some cases they may be slightly lobulated. Slight lobulations may be seen, that may be considered normal. Right. So these are all pictures of normal lymph nodes. So if we talk about normal lymph node, what are the criteria? The criteria is it will be usually less than 0.5 centimeter, maybe ranging between 0.5 to 8.8 centimeter. But whenever it is more than 1 centimeter in the shortest axis, it is suspicious. Whenever it is more than 2 centimeter in any diameter, it is likely to be pathological. It has a central echogenic hilum, which is echogenic because of the fat, and the peripheral cortex is hypoechoic, homogeneous. The size or thickness of the cortex, even in the maximum area, should not be more than 3 millimeter, should be less than 3 millimeter. Vascularity is primarily seen in the central or the hilar region, not in the peripheral portions or in the cortical region. Right, so and normal lymph nodes very often may not be visualized. Usually you will require high frequency lymph probe for the superficial lymph nodes, and for the deeper lymph nodes you will require you may be able to see it with the the normal convex probe. Now, what are the abnormal features? Size more than 1 centimeter in short axis, I have already told you, suspicious. More than 2 centimeter in any axis, likely pathological. Round or irregular shape. Shape is usually oval. If you see a rounded lymph node like this, definitely abnormal. This is abnormal. You can see the diameter of the longer axis and the shorter axis are almost similar, right? So it is almost rounded in shape. Diameter, rather than using the word axis, we may use the word diameter now in these cases because both are same. Then cortical thickening more than 3 millimeter, absence of hilum. Most important thing we are seeing here is no hilum is seen here, no hilum is seen here, no hilum is absent. So hilum is absent, but yes, remember that benign lymph nodes will show you the echogenic hilum, but these are the criteria which are more suspicious: round shape, irregular shape, cortical thickening more than 3 millimeter, focal cortical thickening more than 6 millimeter is highly suspicious feature, loss of echogenic hilum, intranodal necrosis, cortical or peripheral blood flow, and matting. Not necessarily these are the features which are involving the malignancy or malignant lymph nodes. They may be benign also. Some features may be there in benign also. So this is just telling you that these are the features that should catch your eye. I see a round lymph node, that is abnormal. First of all, I see an enlarged lymph node, that is abnormal. Even if it has a normal appearance, if it is enlarged, it is likely to be abnormal, but we need to correlate it clinically also, that whether it holds significance or not. For example, in children, many times we may see enlarged lymph nodes, but they may not hold any significance, right? So they have to be seen in relation with the illness. Then if we find irregular lymph nodes, if we find matted lymph nodes, if we find vascular lymph nodes which are having vascularity from the periphery rather than in the center, then we have loss of echogenic hilum is there, necrosis is there, cystic areas are there, heterogeneous texture is there. These are all abnormal lymph nodes. We are right now not talking about benign or malignant, but these are all abnormal features of abnormal lymph nodes. Now we come to benign versus malignant. What are the features of benign lymph nodes and what are the features of malignant lymph nodes? Right now we are talking about the diseased lymph nodes, right? So size more than 1 centimeter may be there in both. So there is no difference. Size is no criteria to differentiate between benign and malignant. Shape. Benign lymph nodes usually are oval. Malignant lymph nodes are usually round. Margins are usually smooth, maybe lightly lobulated or sharp in cases of benign. In cases of malignant, margins are rather distinctly sharp many cases. But if you find that the margins look irregular or indistinct and you are aware of some malignant disease that is there and you may be thinking that these could be the lymph nodes because of that disease, then they will likely suggest extranodal spread. So that is another point that can help you. The hilum mostly will be seen very well until and unless there is lymphadenitis or something there. Sometimes the hilum may be destroyed, but if it is not seen, then likely malignant, and it can be intubercular too, I told you already, because of necrosis and all. Then cortical echogenicity, usually slightly hypoechoic, almost similar to breast. If we talk about the breast, it will be almost similar to breast fat. So it is generally hypoechoic, while in malignant it may look dark, absolutely. Sometimes no, it may give you, just like I told you, in breast sonography, when we see the malignant masses, no, they may be looking markedly, means they look almost black. When you see carefully, then only you are able to see, no, there are some echoes in it, plus no enhancement is seen, so likely this is a markedly hypoechoic area. And like this one which you see here, see, this is markedly hypoechoic. So that can be, see, even these look dark, but these are not. So that is why I said that criteria is not fixed, but yes, some favor malignant, some favor benign. Then vascularity, mostly hilar, and here it may be peripheral or cortical or sometimes mixed, including hilar, peripheral, cortical, right? Like here you can see, this is abnormal. Not in the hilum, but at the periphery and in the cortex. This is also abnormal. Not in the hilum, but at the periphery and in the cortical region. This is normal, despite the fact that it looks highly vascular, but the vascularity is almost in the central part, right? So you cannot rely on any one feature for differentiating between benign and malignant. There can be an overlap, especially you have to be careful with infected lymph nodes, and you have to relate it clinically also to come to a final point. But yes, these are the features which may tell likely benign, and these are the features which may tell likely malignant. In addition, keep this in mind, matting may be seen. What do we mean by matting? Matting is that dissolution of walls is there between the lymph nodes, and they look like irregular masses. Like these two lymph nodes, 3 lymph nodes have all mixed up. Matting is more a feature of tuberculosis than of malignancy. Intranodal necrosis, like cystic areas, may be seen in the lymph nodes. Heterogeneous appearance of the lymph nodes may be seen both in tuberculosis or infected lymph nodes, or even in malignancy. And this I've already told you, and clinical correlation is important, right? So keep these things in mind when you are looking for lymph nodes related to the other pathology that you are seeing, and then decide. But yes, most important point that helps us to know this is a malignant lymph node is one is rounded shape and another is the vascularity. These two things are more important when we are talking about differentiating benign from malignant. So that is all. Thank you.